Tayyam.
Stroke was the second most common cause of death.
எனக்கு வந்து இந்த இதே தெரியாது.
Stroke or cerebrovascular accident.
எனக்கு பார்த்தனே ஸ்ட்ரோக்ன்றது தெரிஞ்சிருச்சு.
Most of the stroke victims who have been hospitalized within 3 hours have been cured completely.
According to data released in 2011, stroke was the second most common cause of death worldwide, accounting for 6.2 million deaths. In India, nearly 800 out of every 1 lakh people are at increased risk of getting a stroke. This data is getting increased alarmingly at 10% every year in India.
The history of stroke dates back to Hippocrates, who first described the stroke as sudden paralysis that is often associated with brain. Stroke is the literal meaning of the Greek word apoplexy, meaning struck down with violence, which had been reported from the 2nd millennium BC onwards in ancient Mesopotamia and Persia. The term cerebrovascular accident was introduced in 1927, which was then termed as cerebrovascular insult, and now the term brain attack is used. There are different forms of stroke that have different causes.
இந்த சேரில் தான் உட்காந்து டிவி முன்னாடி தான் எழுதிக்கிட்டே இருந்தேன். எழுதிக்கிட்டே இருக்கப்பலே இப்போ நானும் கவனிக்கலாம். ஒரு 2 நிமிஷம் கழிச்சு என்னடா இவங்க இப்படி இருக்காங்க அப்படின்னு 2வது நிமிர்ந்து பார்க்குறப்ப வாயிலன்னு நூலாக வலிக்கிட்டே இருந்துச்சு. நாக்கெல்லாம் உலர்ந்துருச்சு. எனக்கு ஆனால் இந்த மாதிரி சோக்குங்கிறது கால் கை வராமல் போனது எனக்கு தெரியாது.
Like Aragar Sami, many victims may remain unaware about stroke. A few may experience severe headache. They may look confused and may have trouble in speaking or understanding. They may report weakness or numbness of face, arm or leg, especially on one side of the body. They may faint or pass out with sudden weakness. If you see a person developing symptoms like these, then it is time to immediately take them to a hospital which has the facility of administering TPA treatment for thrombolysis.
Stroke occurs to anyone at any time. Stroke occurs when blood supply to a part of the brain gets cut off. When this occurs, the brain cells are deprived of oxygen and they begin to die. About 1.9 million neurons die for every minute following the attack. The functions controlled by that part of the brain, which can be memory, speech or muscle control, are lost. The extent of damage depends on where in the brain the damage has occurred and how much of the tissue is damaged.
For example, if residual particles like dirt enters the tap, it may interrupt the water flow. Or else, if the salt content in water is increased, the salt can slowly accumulate inside the tap and it can interrupt the water flow. In a similar way, if the cholesterol content is high in your blood, it can slowly block the blood flow in your blood vessel. Sometimes there could be a defect in the manufacturing of the tap itself. In a similar way, if a person has a family history of stroke, he is likely to develop a stroke.
There are different forms of stroke that have different causes. A mini stroke, also called a transient ischemia attack, that is, TIA, happens when normal blood flow to the brain becomes reduced for a short time. Hemorrhagic strokes are caused due to bursting of arteries resulting in leaking of blood over brain cells. The hemorrhaged blood exerts pressure on brain cells and damages them. Ischemic stroke is the most common type of stroke and is caused by blocked and narrowed arteries that supply blood to the brain, resulting in ischemia, which means severely reduced blood flow. It occurs as a result of obstruction due to fatty deposits lining vessel walls within a blood vessel. These fatty deposits can cause two types of obstruction. Cerebral thrombosis refers to a thrombus, the blood clot, which is developed at the clogged part of the vessel. Cerebral embolism refers to blood clot that forms at another location in the circulatory system, travels through the brain's blood vessel until it reaches a vessel that is too small to let it pass. About 8 to 10 brain attacks are ischemic strokes, and now a timely treatment is available for stroke. Ischemic stroke can be completely cured if the patient is treated within 3 hours after the onset of the stroke.
முகத்தை பார்த்தோன்னா வாய் வந்து ரொம்ப இந்த பக்கமாக இழுத்து கண்ணெல்லாம் ஒரு மாதிரியா வித்தியாசமாக இருந்துச்சு. நான் அப்புறம் கை பார்த்தா அப்படி இருந்துச்சு. இந்த கையை மட்டும்தான் தூக்குறாங்க, இது தூக்குனா ஒன்றும் பண்ண முடியல. அப்போயே நினச்சிட்டோம், கையையும் தூக்குங்கன்னா முடியலன்னொடனே ஸ்ட்ரோக் தான் அப்படின்றது இங்கேயே நாங்கள் கன்ஃபார்ம் பண்ணிட்டேன்.
Mr. Singaravelu was taken to the hospital within the stipulated time and was saved from the disaster of remaining paralyzed lifelong as a consequence of stroke. He was given TPA therapy within 3 hours after the onset of the stroke. TPA, tissue plasminogen activator, is a drug that breaks up the clot by helping to regenerate the enzyme plasmin, which digests the fibrin strands, restoring blood flow. In other cases, the clot can also be mechanically removed using an appropriate device called thrombectomy device. According to WHO, 60 to 85% of people in the world, from both developed as well as developing countries, lead sedentary lifestyles, making it one of the more serious yet insufficiently addressed public health problems of our time.
These sedentary lifestyle factors account for the increased risk of getting a stroke.
The main factors that cause stroke are old age, high blood pressure, high cholesterol, uncontrolled diabetes, smoking cigarettes, irregular heartbeat, unhealthy diet, lack of exercise, family history of stroke. The after effect of stroke is different for every stroke affected person, and it is very difficult to predict on how much recovery is possible. Many stroke survivors experience the most dramatic recovery during their stay in the hospital in the weeks after their stroke. However, many stroke survivors continue to improve over a longer time, sometimes over a number of years.
தைலம்
தையம்
திங்கள்
தென்லை
தீபம்
தேவம்.
Their recovery is in fact a long period of rehabilitation as they learn to deal with the effects the stroke has had on them. For conveniently remembering the symptoms of stroke, remember the word fast. F means face, A means arm, S means speech, then it is T. T is the precious 3 hours of time to save the patient's life. It is essential to take the stroke victim to the hospital within 3 hours after the onset of cerebrovascular accident, that is, a stroke. The first 3 hours are said to be the golden hours in the life of a stroke victim because the brain cells would die at an alarming rate of 19 lakhs per minute. Complete restoration of the dead cells is not possible after 3 hours, and that's why it is said to be the golden hours. So make sure that you admit the victim in a hospital within 3 hours of the attack. Check also whether the hospital has a stroke unit, a ward that is dedicated for stroke treatment. Experience shows that victims admitted to a stroke unit have a higher chance of surviving than those admitted elsewhere without this facility. Some doctors believe that getting thrombolized, that is, removing the blockage by breaking the clot down or mechanically removing the clot, is the right of the patient and one can demand for that.
In recent times, most of the stroke victims who have been hospitalized within 3 hours have been cured completely, enabling them to lead near normal lives.
Diagnosing stroke and getting admitted to a hospital within 3 hours would save victims from lifelong suffering.
Take the patient to a hospital where TPA medicine is available within 3 hours.
So kindly spread this awareness about stroke to your friends and relatives and save them from the potentially disastrous consequences of stroke.
Be aware and spread this awareness of the life-saving medicine, that is TPA treatment, which is to be given within 3 hours of the onset of a stroke.